Okay, so not just strategy, but there's some other tips that you can apply to a lot of different kinds of questions. Okay, so if you're given 4 patient choices and you're asked, which patient do you need to see first? Which one is it most important to see? And this only really works if you have 4 patient scenarios as your answer choices. Okay, and it'll be something like the nurse gets report, and who do you see first? Okay, or who are you going to call the doctor on, or whatever. And so what you're going to do is you're going to say, well, I'm looking for the most unstable, sickest, crashing patient. That's the one the RN should see first, right? Same thing if you're delegating. The RN needs to take the sickest, most unstable patient. So that's basically your method for that. So you're going to go through each patient and go, are they stable or unstable? Sometimes that's hard to tell, okay? And then you can go to expected or unexpected, and that's a really good tiebreaker as well. In addition to the, if I can only do one thing and leave the room, what is it going to be? Is this an expected outcome or unexpected? If you have a COPDer who's short of breath, that's expected, right? Versus a COPDer that comes in and they have a high fever. That would be unexpected. Or they have a change in their blood pressure. So that's a really good tiebreaker. Then you go to ABCs, and that can help you also because you want to see the airway patient first. And it doesn't necessarily, it's not going to necessarily say airway. It could say that they're here for potential anaphylaxis. Well, you know their airway's going to swell up, right? And then you can look at acute versus chronic, because we're going to see the most acute patient. If this patient has a chronic illness versus someone who's just come in with a new diagnosis, you have a new diabetic, comes in with a sugar of 300 and A1C of 10%, versus the patient who is here with the COPD, their O2 sat is 92%, they're short of breath. You're going to go see that diabetic first because they are more acute. You know, and that's why at the very end, before you select your answer, you always want to go, okay, is this truly the most unstable patient? And then kind of make sure that you've picked the right choice, okay? And it would be the same thing as if you were giving medications. You're administering meds to 4 patients. Which one would you see first? It's going to be the same method, okay? There are some traps to look out for. As a nurse, we don't ask why. We don't care why the patient is refusing treatment. We don't care why they're making the choices they do. It's confrontational. So if a patient says, I no longer want to do dialysis. I'm 85, I've done dialysis for 5 years, and I'm done, which happens all the time. You're not going to go, well, why not? Okay, and you're not also not going to try to persuade them, but you need to do dialysis for your family so you can stay alive. We don't do that either. That's confrontational. What we do is we educate so the patient can make an informed decision, and then we support that decision once they've been informed, and we advocate for them. Okay? So we don't persuade, we don't ask why, we never say don't worry. The minute you tell a patient don't worry, it'll be okay, they die. It's like, oh, but it was going to be okay. Who are we helping when we say don't worry? Us. We're making ourselves feel better because sometimes it's a pretty sucky scenario. Patient's got a terminal illness, they're dying. You can't say it's going to be okay, right? I'm here for you. I'll sit here and listen with you. Or I really don't know what to say, but I'm happy to answer questions, that type of stuff, okay? We don't leave the patient. So if something's going on with the patient, you send other people to get stuff, right? And you stay with the patient. We don't do nothing. Doing nothing is something like calling the doctor, assessing again, telling the family to come and watch the patient, like they're confused, right? Calling the family to come in and sit with the patient. Well, the nurse isn't actually doing anything. You want to answer, what is the nurse doing for the patient right now? okay? And you want to focus on the client. It should be about the client's feelings, the client's illness, the client's vitals. It should not be about the nurse, okay? And then you want to be factual. So like if it's a charting question or communication question, it's like just the facts, ma'am. You don't need to give any fluff or try to make things sound better, just the facts, okay? And when you're charting, it's just the facts. No opinion or any of that stuff. Okay, so those are some tips. There will be more later, but that should get you started, okay?